For anyone facing kidney disease, Naples Nephrology provides highly personal expert care with multiple sites available.
The mainstay of therapy here is early diagnosis and aggressive intervention of kidney disease.
Trust the leading practice in kidney care, peritoneal, and hemodialysis. Dr. Russo and Strichevich are board-certified kidney specialists. See how we're making a difference. Visit fox4now.com and click on Health Now for Naples Nephrology. Welcome to Naples Nephrology, providing the very best medical care to patients with kidney disease. If you're facing dialysis or transplant, our highly trained team is ready to guide you. At Naples Nephrology, we're involved in clinical research. This arrangement allows our patients access to the latest drug therapies that may assist in improving the overall quality of their life. Let's meet some of the leading specialists in this field.
Hi, I'm Dr. Mark Russo here at Naples Nephrology and the Kidney Institute of Naples and North Naples Dialysis Center. We've been practicing here since late 2001, early 2002. The mainstay of therapy here is early diagnosis and aggressive intervention of kidney disease. And this is what typically nephrologists do. Whenever anybody hears the term nephrology, they're uncertain what is a nephrologist. And a nephrologist basically is a physician who cares for individuals who have kidney disease. Many individuals in our society today have kidney problems from long-standing hypertension, diabetes, polycystic kidney disease. Some of the early signs of kidney disease may be as mild as a small elevation of the individual's blood pressure. It may be some mild protein in their urine or blood in the urine. It may be swelling in their legs. Diffuse itchiness or pruritus, as we call it, may be a sign of kidney dysfunction. It's imperative to diagnose these problems early on and see your physician on a regular basis for a regular blood test, urine analysis, and once it's detected early, we may be able to determine what the cause of the kidney problem is. Sometimes individuals may require a kidney biopsy. It's a relatively straightforward procedure. It is not painful. The individual remains awake during the entire procedure. Not everyone that walks into this office needs a kidney biopsy. We can diagnose many of our problems just by the simple blood and urine tests. It's also imperative to diagnose these problems early on so that we can take the aggressive approach at Naples Nephrology. And then we can slow down the progression and avoid these individuals from having to go on dialysis or needing a kidney transplant. Unfortunately, sometimes people wind up progressing in their kidney problems and wind up having to go on dialysis. There are several forms of dialysis. There's home dialysis or peritoneal dialysis. There's hemodialysis, and those are only to be utilized as bridges until the patient gets a transplant. And they'll choose that therapy and go through the training, etc., with our nurses. They meet with our social worker, they meet with our dietitian, and they talk about or they discuss the variety of dietary changes. Once they're evaluated by all the staff members, we continue to follow them on a regular basis as often as necessary and send them for access placement if needed, and of course the transplant evaluation. This is all done at Naples Nephrology and the Kidney Institute of Naples. And here at Naples Nephrology, this is what we do differently, I think, than other nephrologists. Once a person gets to a kidney function of about 20%, they can be listed for kidney transplant. What we do here is we send them locally for all the testing so that they don't have to be inconvenienced at a facility outside the area of Naples. And that's what we do here differently. And we're very proud of that. Once an individual gets all of this information, that packet now is sent to a different transplant center, whether it be Miami, Fort Myers, Gainesville. We just want the person to get the kidney transplant. After several months, we take back over control of the patient and care of the patient. And the patients seem to very much enjoy that and like it. Recently, we've been lucky enough to have Dr. Strichevich join the staff. She's here with us almost 2 years now, and she brings a more personable role to Naples Nephrology.
I said, being that our patients tend to be very with the multiple medical problems, you get to know them very well and their families. I don't think that anything comes anywhere close to satisfaction of seeing a patient when they receive a kidney transplant and you can take them off the dialysis People very often think once when you're on dialysis that this is for life. You'll never be able to get off these treatments, and taking them off dialysis and they're now continuing with a normal life, coming back to the office, and the gratitude that they have and the happiness from the whole family it's priceless. The PD dialogue is, I would say, something pretty unique that we have in Naples Nephrology and the Kidney Institute. It's mostly educational for the patients who are pre-dialysis and patients who are already on dialysis. From the patient's perspective, not only the doctors and nurses' perspective, but directly from the patient's perspective, how is it to be on dialysis, what they can expect. I think the most important thing is that it comes straight from the patient to another patient. So it's very honest, it's completely different look on a dialysis than what the physician may have or the nurse can have, because these patients are living the life of a dialysis patient.
I can't say enough about him. I like his personality. I like the way he knows who I am, and he knows my daughter, he knows my husband died, all that stuff that most doctors don't even get involved in. So he's been very good. Because of his good humor and his positive outlook, I think every patient in here really enjoys his coming in and talking to him. But it goes further than just him, because this whole center, if you're here for a while, you hear a lot of laughing. And I don't know how they choose the people who work in here, but I do know that most of them, or all of them, have the same personality that he does. So they're very kind, and if you ask questions, they will, they're not too busy that they can't talk to you. So I think that this dialysis center's personality is just carried over from Dr. Russo.
I've been diabetic since I was 17, so it all ended up because of my diabetes. At first I was scared to come over here because I didn't know, I was just thinking about needles and stuff, but they made me feel comfortable. And whoever starts in dialysis, this is a place that I would come. I mean, they're friendly, they're caring, and Dr. Russo is a good doctor.
Visit this website to learn more about our team and life-enhancing choices. We'll answer any questions you have online. To schedule an appointment, call 239-513-1002. Naples Nephrology, early diagnosis and aggressive intervention.